Do you like helping others? Are you someone who excels in attention to detail? Then a career in the health science cluster may interest you. Health science workers promote health and wellness. They diagnose and treat injuries and disease. As a physician, dentist, or nurse, you could work directly with patients. You could also work in a laboratory to get information used in research or provide administrative support by keeping medical records. Health science jobs are found at a variety of different sites. For example, you could work in a hospital, office, clinic, or nursing home. Or you could work on a cruise ship, at a sports arena, or within a patient's home. There are over 90 careers across 5 career pathways in the health science cluster. Those pathways include therapeutic services, diagnostic services, biotechnology research and development, health informatics, support services.
My job story is an interesting story, certainly to me, because it really starts with what I love the most about being in healthcare, and that's caring for people. I was drawn to, more than 25 years ago, go into the nursing profession first. I wanted to take care of people. And so I was able to obtain my associate degree from Vernon College and became an RN, something that I applied to my life. And certainly I tell nursing students all the time, the really amazing thing about becoming a nurse is that you can take that nursing career base and go so many directions with it. And even though I've said that over the years, it's really something to see now that here I sit as a hospital CEO. Ultimately, I got my master's in nursing, and then I went back also and got my master's in business. So I am able to live my passion out every day of leading people and also knowing that I take care of patients. You know, a typical day in my life as a CEO is not very consistent. I don't work in a world where I can count on every day that I go to work and I start in at a certain time and I put this number of widgets in this box. But probably for me and the person that I am, that works for me. While a lot of people, I have a couple of kids that love the daily routine and they choose careers that help that. For me, I like to choose a career that brings variety. So my day, it's calendar driven to a point, but if we have a physician who has a need, I drop things and take care of that. If we have a patient or a visitor that has a concern or needs a little extra help with something, I take care of that. I work really hard to make sure that our staff that work here are happy so that we can continue to provide care. So, you know, there is no typical day for me as a hospital administrator, but there certainly is a lot of variety and community engagement and meetings and seminars, and you know, probably the consistent thing I do every day is read my email, but other than that, every day is a new day. The thing that I love about my work the most is that when I went into nursing, I knew my 2 hands would be taking care of people. And then as I went on up into leadership, I had to get my mindset that, well, my 2 hands don't do it anymore. If I'm a good leader, I have a lot of hands taking care of people. So I love my job and I love what I do because I take care of doctors, I take care of staff. And then if I do those things well, then I know all the patients that interface here will get good care. And so I really love my job because I'm fulfilling a mission by being a good leader for those who depend on our staff here. A hospital offers so many different types of jobs, and really a place like Vernon College, one of the reasons I am not only an alum, but I'm a supporter of Vernon is because it's a great place to get a foundation. We depend here at the hospital on a junior college, most importantly Vernon, because there are a lot of degrees you can get and come to the hospital and not have to go get a full 4-year degree. You can be a nurse, you can be a lab technologist, a respiratory therapist. You could going into accounting and do accounting here at the hospital, purchasing. We have chefs that work at the hospital that come through the Vernon culinary program. We have dietary staff that don't go to college, but they come here and they work in our food and nutrition area. There are so many jobs at the hospital, from being the physician or the surgeon, to being the receptionist, to being the accountant, to being the maintenance repair people. So really, If you have a skill or an ambition in your life, a hospital very likely might be a place that you could fulfill that. And that's one of the reasons I love the diversity we have, our security guards and how much we depend on them. So I just think of all the different careers. Housekeepers. A housekeeper could work in a hotel. They could work in a hospital. They could work, in a school. And so there's a lot of environmental services workers here. There's a lot of positions like that. So we offer a really large variety of professions here. The primary skill that certainly is required to work at Crossroads Community Hospital is being nice. If you can bring some respect for other people and for human beings and good old-fashioned manners, we can help you be successful at anything. For a long time, I feel like I've talked with people about the fact that we need to be nice. When people are vulnerable and they're in need of care, just being kind and polite and having a smile on your face goes a long way. So while some people may say that's not a skill, it's a behavior, I think it kind of is both. That's the only skill we can't teach you. We cannot teach you to be nice, but if you can be nice and respectful to others, then we can help you along the way here at the hospital to learn the trade that you're seeking out to learn. The advice that I would give to anyone who wants to consider a career in hospitals or clinics would be, first, do a heart check. And if in your gut, in your heart, you want to be a caring individual to other people, then you're in the right place. So it's not only that I would give you that advice, I would plead with you. Don't come into healthcare if you can't have that compassion toward others. We talk about this a lot in our leadership teams here. A person might say, I work in purchasing, so I don't touch patients, I don't get around patients, so I don't have to be that kind of person. But you do, because when you're walking down the hall and you went to the cafeteria and someone is lost in the hall and they're vulnerable, you don't know that they might not be going to see their mother or father to say goodbye in ICU for the last time. And they might need you to be kind and compassionate and help them get to the ICU. So for me, I would ask anybody that's looking to be into healthcare, the beauty is if you don't like to be around blood and guts, you don't have to be. You can do all kinds of jobs and not have to be around that, but you really still need to be kind and compassionate. So my advice would be, 1, check in with yourself and make sure you can be that kind of person. And then 2, follow your dream. Go after it and understand that your dream today can be a first stop destination on your journey for tomorrow. When I became an RN, I did not think 25 years later I would be a hospital CEO. But I've had many jobs and destinations along the way. And I talked to a lot of people that maybe started out being an operating room scrub technician, and then someday went on back and went to nursing school and maybe even ended up as a nurse practitioner. So there's a lot of avenues in healthcare that you might start out as a registration person in a clinic and then decide you want to go get a business degree and be a manager of a clinic. So I would just say to you, follow your dream and get started with something. It doesn't have to be the end destination, but you'll never get where you hope to go if you don't start. I would encourage any student who wants to work in healthcare to talk to people in healthcare. Almost everyone knows a nurse, a doctor, a respiratory therapist, someone who works in admitting at the hospital. And if you don't, ask your teacher or ask a guidance counselor to put you in contact with someone, because almost everybody that I know in healthcare is very willing to talk to a student who might have interest. We do all kinds of outreach programs with local schools and high schools. We are always very willing to talk to students who have an ambition or a desire to want to go into healthcare. So I would just encourage you, find a mentor person, talk to them about what their career path looked like. And so maybe you talk to someone and they're a pharmacist and you say, I know for sure I don't want to be a pharmacist. Who do you know that would talk to me about being a lab technician? That pharmacist can put you in contact with someone. So I would just say, ask a lot of questions. I truly started nursing school and didn't do that. I went right into nursing school thinking I wanted to take care of people, and I didn't have any mentors in my life. I didn't really know anyone to talk to, and it made me less informed about what my journey ahead would be. So my advice would be just talk to people, get a circle of people who will support you, and jump in and start.
If you are interested in a career in health science, Renlink College is here to help you prepare with a variety of programs to develop the knowledge and skills needed. Renlink College has career technical education programs such as Basic Nursing Assistant Certificate, EMT Basic Certificate, EMT Paramedic Associate of Applied Science Degree or Certificate, Medical Assistant Associate of Applied Science Degree or Certificate, Associate Degree Nursing, Medical Coding Certificate, Medical Support Specialist Certificate, Personal Care Aide Certificate, Pharmacy Technician Certificate, Phlebotomy Certificate, Practical Nursing Certificate, Radiologic Technology Associate of Applied Science Degree, including MRI Certificate, Computed Tomography Certificate, or Veterinary Assistant Certificate, or transfer degree programs such as Pre-Dentistry Associate of Science Degree, Pre-Medicine Associate of Science Degree, Pre-Pharmacy Associate of Science Degree.